Within the last 90 minutes, Jefferson County reported its first death related to coronavirus. Thank you for joining us. I'm Steve Savard in for Claire Kellett. The Jefferson County Health Department reports the victim was a woman in her 80s who had been hospitalized. Missouri officials now report more than 1,800 confirmed cases in the state, and News 4 has confirmed there are at least 24 deaths. Illinois reports 715 new cases today. There are now 7,695 cases and 157 deaths. The vast majority are in Chicago and the surrounding counties. As the worldwide number tops 1 million cases, we have live team coverage this afternoon detailing efforts to make sure everyone has enough to eat, and Missouri Governor Mike Parson facing his critics on social media. We begin with a look at where the virus might hit the hardest. There is fear in our area the virus will have a major impact on certain groups. News 4 investigative reporter Lauren Traeger has been analyzing the data. She joins us live. Lauren, there's a sense that disadvantaged communities will be hit hard.
Yeah, that's absolutely right. Here in St. Louis County, we are still waiting on the data to be broken down by zip code. Leaders have vowed that they will release the number of positive cases broken down by zip code. Yesterday, the city of St. Louis provided that data, but today Mayor Lyda Krewson tells me she wants the data broken down even further so we can better understand which groups may be most impacted by the virus.
For me, it's a persuasive piece to the public that this applies to everybody. This virus affects all of us, no matter what zip code.
St. Louis City Mayor Lyda Krewson says it's clear there's community spread nearly everywhere.
And so what we're trying to do is change people's behavior.
Digging into the data, this graphic shows the city's zip codes with the highest number of cases. 22 cases on the city's north side, 14 cases in the south, in the Bevo Mill, Tower Grove South area, and 22 cases just west of downtown. Although all those cases reportedly come from one place, the Life Care Center, a nursing home.
We do have pockets of high poverty, high underserved populations.
Adolphus Pruitt of the St. Louis NAACP says the numbers in the north and the south point potentially to disadvantaged communities, groups of people that statistically have higher numbers of health issues, less access to health care, and lower life expectancies.
So when you add all that together and you throw coronavirus into the mix, it really paints a potential grim picture.
He says race should also be tracked, and Mayor Krewson agrees.
Is that important for you to track, though, to see if there are people disproportionately impacted?
I think it is important. What we've seen so far, what I looked at a couple days ago, is about equal numbers black and white, but a whole lot of people that we just haven't recorded their race.
Experts also say another key piece of data, hospitalizations.
I don't have that data right now. That's data that we want, and data that we're talking to hospitals about, and data that we expect the state to be tracking. But everyone in this is moving so quickly.
And so, of course, all that data is still coming in now. Late this afternoon, just within the last hour, the state health director said he would be releasing the number of ICU beds, information about hospitals tomorrow. So we should have that information tomorrow to bring to you. Now, coming up on News 4 at 6, we are looking at some new testing locations that may be available soon in some of those disadvantaged communities. Again, that's on News 4 at 6. Reporting live, Lauren Traeger, News 4.